Hey everybody, Chris again from Rasayana, and I wanted to make this brief video and share with you a story that I was thinking about the other day from more than a few, actually, many years ago, when I was a massage therapist at a group practice before I went out on my own and began my Rasayana practice. I worked as part of a group, and as I still do, get regular massages myself as a full-time body worker and massage therapist and yoga instructor. I am using my body physically every day, like many of you, and need to take good care of it. And one of the ways that I personally do that is by getting a professional massage at least every 2 weeks. And I don't normally go to get massages from colleagues or people that I work with, but on this particular day, it was all that was available to me, and I was in great need. So I booked a session with this woman, and this woman's specialty was in massaging cancer massage. Now, I trusted that her touch would be compassionate and nurturing and so forth. So I had no problem making an appointment with her, and was excited to get on the massage table and receive myself. And right before we began the session, she says to me, "Oh, and don't worry, I know, don't worry, I'll use tons of oil and just slather you in it. I know that that's what you like and that you like your massages like that." And I kind of paused because this was by no means booked as an Ayurvedic massage, which is what I think she was thinking about, which she knows is my specialty, and thought that that was what I was looking for that day, which it wasn't. I was actually looking for some structural work that I needed, and certainly was testimony, evidence, of her not understanding what Ayurvedic massage really is. And while it certainly does use copious amounts of oil in its treatment, it is how it's managed and applied that makes it different from Western massage. And so she's very sweet and very pure, and it certainly was an interesting session, even after I informed her that she needn't use copious amounts of oil for what my goals were that day. She continued to anyhow, and so it didn't give the traction and the manipulation of the soft tissue that I was hoping for. And I mentioned this and found the story important to share with you because I think it demonstrates some of the key qualities that a good practitioner needs to have. And for her, in this instance, it was knowledge. She had a lack of knowledge, theoretical knowledge about what Ayurveda is and what Ayurvedic massage is specifically, the Abhyanga, as it's called. And so that lack of knowledge wasn't going to make her treatment very effective for me. And while she had the right intention and the love was there, without that knowledge, obviously, your treatment plan can't be effective. So that made me think about other qualities that a solid practitioner needs to have. And other than primarily that knowledge, theoretically, in your craft, in your science and system, I mean, you have to have that in order to have effective treatment plans and guide your clients and patients safely, and establish and build trust. I mean, if you don't have that knowledge, you're not going to be able to help your clients get those results. And so the relationship is not likely to last long, and you certainly don't want to injure or harm anybody. So that knowledge is really important in your craft. And if you're rusty in it, or if you haven't practiced in a while, then you need to go back and invest some time in refamiliarizing yourself with the theory, because the theory is the foundation on which you're practicing. Which leads me to the other qualities, which is practicing it yourself. And so, I think what differentiates a good practitioner from a great practitioner is one that is constantly practicing the system, craft, or science themselves in their personal lives. Chadak, the author of these ancient medical texts in Ayurveda, says that the 4 qualities of the physician should be theoretical knowledge, purity, practice, and dexterity, or flexibility. Not physically in the body, of course, but flexibility in your treatment approach. Flexibility in how you're going to work with and within the limits of your clientele, of your patients, and meet them where they're at and work from a middle of the road approach. It's just one of the many lovely things about the system of Ayurveda that I love, in that it is gentle and natural and about relationships. And when we bring force into something, into a treatment, a healing approach, a relationship, a yoga posture, we injure. So it's good not to use force. And Ayurveda, being so gentle, really allows the environment, it allows the landscape, if you will, for the doctor, practitioner, healer to find that doorway in to where that trust can be established and maintained, where treatment plans can be clear, safe, and effective, and where you're able to provide the most impact in your personal life through the daily practices, and in your professional life with your clients and your communities. And so with that, I want to share with you a case study, one of the many examples over the 10 plus years that I've been offering professional Ayurvedic massage and Abhyanga, that demonstrate exactly how knowledge and practice will allow for great results. I have a 63 had actually. She's still she's still alive. Don't worry. But a 63-year-old woman had come to me for some help. She had been diagnosed with metastatic breast cancer back in 1996, and she had to have a mastectomy and breast reconstruction, and also 2 years of chemo. And the chemo medication was really rough for her. And after doing it for 2 years, she just couldn't take it anymore. The side effects were too much. And so with the guidance of her physician and oncologist, modifications were made in that regimen. But what she was looking for help with me with was the resulting lymphedema. She had a lot of swelling in the body, swelling of the fingers, swelling of the feet, ankles, and lower legs. In fact, with her history of the chemo and I think she even had radiation as well. She had other side effects, like she had these blisters that were appearing on very painful blisters on the tops of her feet. And she would have chronic eye styes, very painful eruptions on the lids of her eyes, and just was really having a rough go of it. Wearing compression stockings every day up to the thighs, and just not having the energy levels that she felt she needed. And she really wanted to be able to get into a pair of shoes for her daughter's wedding in July. So she came to see me in mid-June, and the wedding was in late July. And her goal was, I just want to be able to fit into the shoes and wear proper shoes at my daughter's wedding. And so, obviously the edema was a factor in why she wasn't able to do that. And so we embarked on a series of regular Abhyanga treatments, these Ayurvedic massages that circulate the lymph for her. And because of my knowledge and training as an Ayurvedic health counselor, I was able to also integrate specific botanical formulas into those oils for her. But for the scope of practice as a massage therapist here in the state of Massachusetts, I'll limit the training to the actual effects of the manual technique and how that impacted both the physical and subtle body. For this woman, this client, we had begun with very, very light, dry brushing called Garshan. And I was able to get her to begin implementing that for herself on a daily basis as a practice at home. Obviously, avoiding the areas where the blisters were and the other sensitive areas where there was really dry and cracked skin. But otherwise, where the tissue was healthy, she was able to very lightly use this Garshan technique and then come to see me about every 2 weeks, and then a little bit further out in between as the months progressed for the traditional Abhyanga massage in my office. And so with that treatment, I would see her every 2 weeks, and by the time she had the wedding in July, she not only had less swelling, she was thrilled, first of all, after the first appointment, that she said she had the best night's sleep she had had in over 5 years. So that really made me happy and spoke to the restorative quality of the Abhyanga treatment, nourishing not only the tissues, but calming the nervous system itself so she could rest. She was able to take off her rings that she hadn't been able to take off for many months, and she was able to fit into her shoes and go to the wedding. And by the time I saw her again after the wedding in September, she not only had been able to maintain the levels of energy that she was having, but the pigmentation of her lower limbs had changed from what started as a very dark purple color, like a bluish purple. There were very, very dark pigmentation of the lower limbs below the knee. Had eventually changed and was much more pink and much more natural looking in terms of the circulation in the skin. And she was thrilled she hadn't had any eruptions of those painful eye styes, and how in general she was able to feel more in her body, and that her hair and her eyelashes had begun to grow back. And she was thrilled about this because that was something that she, like most women, had struggled with in terms of body image. And so it was a really wonderful trajectory for her over 6 months of regular Abhyanga treatments and her implementation of some of my recommendations for herself at home. And so this was just one of many successful case studies that I've had in my private practice, and gives testimony to its therapeutic value, that these treatments are not simply spa treatments or skin treatments, although they are those too. What they really are is a vehicle for powerful healing and medicine. So keep that in mind as you move forward with these mini trainings, or if you decide to come to one of my live trainings, and how we can apply the practice of Ayurveda in our daily lives to become exceptional practitioners and have the impact that the world needs. Namaste.